was done. It says gallbladder stones, but we know less than 30% of gallbladder stones are properly seen on CT scans. You should get an MRI or a sonography for this, because no, it makes no sense. And of course it's enhanced, and by they didn't properly put in the data here at the system, so it says unenhanced in some section of my system, and it says enhanced on the part on the exam request. So this is a female patient. She is 35. Yes, she's 35, and she has some kind of gallbladder disease that needed to be assessed by a CT scan, which by itself makes no sense, but whatever. Sense has gone through the door a long time ago. So we have a pre-contrast phase right there. It's properly done, and I can see the gallbladder stones. Yes, I can. And I guess you guys can see it too. If not, I'm going to show you guys in a moment. So it's right there, just that. And we have a arterial phase, which makes no sense for an acute abdomen, although it's properly done, I suppose, just to serve the patient with another high dose of radiation for no meaning. Why not? And we have a portal phase that I suppose is properly done too. Yes, it's on time, properly done, thank God. Right there. No, it took off a bit of the liver, but whatever, who cares? So let's go for pre-contrast and post-contrast portal hepatic phase or venous hepatic phase. Might be a small enlarged spleen right there. I'm just going to do an MPR to take that measurement as in a few moments. Just stay there. So there is indeed some heterogeneity on the inside of the gallbladder. I can see there is some calcification right here, and there is some very black spots that are really close to the air and to the adipose tissue right there. See there, and a bit there, here and there. This isn't air nor gas. This is just the constitution of the gallbladder stones. So they come from the neck of the gallbladder all the way to the body and the fundus. So it's all over the gallbladder. So this gallbladder is filled up with stones. Is it inflamed? It doesn't seem to be inflamed because the fat pad around it is normal, and it isn't excuse me, it isn't enlarged to a degree that I could say it's inflamed. It's just 41. This is just regular gallbladder size. So this is not a CT scan that we can tell it's a cholecystitis. This is not a inflamed gallbladder. It isn't. It's just a regular gallbladder filled up with stones. So this is just a crisis, a gallbladder crisis on a clearly obese young female patient that eats too much sugar and too little fat. Yes, this is what causes gallbladder disease. I'm sorry. It's a hard truth, but high carb, low fat diets are crap. And since no one is actually watching this live stream, this statement makes No difference whatsoever. So the kidneys are fine. The liver, we can see there is some mild edema of the periportal fat, the periportal sites. This is clear, and this is very common on crisis, on acute painful events of the gallbladder, and also in acute hepatitis patients. Although I can't really say this liver is enlarged, it seems of normal size. Let's see just if the spleen is enlarged. No, not enlarged, just felt like it. Let's measure. It's a bit enlarged, maybe. It's supposed to be less than 12, and it's 12.2, almost 12.3. So if I bring back my calipers right there, and I put them in the proper location, it's going to be less than 12. So there is no splenomegaly nor hepatomegaly. So coronal is for kids. We are real grown men, so we don't do coronal, we just do axial. I'm sorry if you are offended. Go practice more your axial skills. So portal vein is fine. The pancreas and the peripancreatic fat is fine, and this is a very important feature of this exam because we know the main cause of pancreatitis is gallbladder disease, gallbladder stones migrating towards the duodenum right there. See, this is the choleducus. This is the common hepatic